The ongoing debate over gender dysphoria. Even today, the boundaries of identity-based abnormality remain a site of cultural contention, demonstrating the ongoing influence of social norms. The current diagnosis of gender dysphoria, GD, replacing the older term gender identity disorder, is a careful compromise within the DSM. The current diagnosis focuses almost entirely on the distress and dysfunction caused by the incongruence between one's assigned gender and experienced gender. The core idea is that the gender variance itself is not the disorder. The suffering it causes in the face of rigid societal and institutional norms is the clinical problem. However, the debate reflects clashing societal norms. For critics, the inclusion of GD pathologizes a normal, natural variance in human identity, akin to the historical pathologization of homosexuality. For proponents, the diagnosis is a crucial tool. It provides the diagnostic code necessary for individuals to access life-saving, medically necessary care, like hormones, surgery, and therapy, which is mandated by Western health insurance systems that operate only on the basis of a diagnosis. The diagnosis exists not because gender variance is inherently sick, but because the societal norm of rigid binary gender forces those who deviate into a state of acute medical and financial vulnerability, making the diagnostic label the functional necessity for survival within the medical industrial complex. The emotional reality is a deeply conflicted one, the relief of access to care versus the lingering pain of having one's identity defined by a mental health diagnosis. Non-Western context, culture-shaping manifestation and focus. When we shift our focus to non-Western and indigenous contexts, we see that culture's influence is not just about judging a behavior, but about shaping the very form and content of the abnormality. In these societies, the prevailing cultural beliefs, emotional lexicons, and spiritual frameworks provide the raw material for how psychological suffering is experienced and expressed. The DSM-5 now recognizes this under the umbrella term Cultural Concepts of Distress, CCDs, acknowledging that mental illnesses manifest differently across the globe. In collectivist and high-context cultures, where harmony, social hierarchy, and the suppression of individual conflict are paramount norms, emotional distress is often expressed somatically, as physical symptoms, rather than explicitly as a psychological state. The culture may lack a word for depression, but has a rich vocabulary for describing heavy heart or stomach heat. Acknowledging pure psychological distress may be seen as a violation of the norm of collective strength. Example 3. Amok in Southeast Asian cultures. A classic and historically recognized cultural concept of distress is amok, predominantly found in Malaysia, Indonesia, and other Southeast Asian cultures. In these highly traditional collectivist societies, the overwhelming societal norm is the suppression of individual anger, aggression, and conflict to maintain group harmony. Overt displays of rage or frustration are profoundly deviant and considered shameful. The mechanism of abnormality. This intense social pressure can lead to a dangerous buildup of emotional stress. A person, typically male, may experience extreme shame, humiliation, or social pressure, like being publicly disgraced or having a major financial loss. Unable to express the rage due to rigid social norms, the pressure is internalized. The resulting abnormal behavior is the sudden, explosive, dissociative episode known as running amok. The emotional reality. Consider Hatim, a young man in a small Malaysian village who suffers a severe public humiliation related to his business dealings. The cultural norm demands that he absorb this shame without comment, maintaining a calm, passive demeanor. The rage and self-hatred, suppressed for weeks, eventually reach a breaking point. Suddenly, Hakim snaps. He enters a state of deep dissociation, grabs a weapon, and begins a frantic, violent rampage, attacking people indiscriminately until he is subdued or killed. This act is severely deviant and dangerous, yet its form is directly dictated by the culture. Amok is not merely a random act of violence, it is a culturally scripted psychological event. The dissociation is a complete rupture from the self, allowing the person to commit the ultimate violation of the social norm, violence, while simultaneously providing a psychological escape valve. that their culture, by its restrictive norms, demands. The culture creates the psychological pressure cooker and also scripts the violent, temporary breakdown. A Western clinician might label this a brief psychotic episode with violence. A local healer would understand it as a temporary state of soul loss brought on by unmanageable social pressure. Example 4. Taijin Kyofusho, TKS, in Japanese culture. A particularly illuminating contrast with Western norms is found in the Japanese cultural concept of distress, known as Taijin Kyofusho, TKS, or fear of interpersonal relations. While Western social anxiety is characterized by the fear of being personally embarrassed or negatively judged, fear directed inward, TKS involves the crippling fear of offending others or making them uncomfortable by one's appearance, body odor, or social behavior, fear directed outward. The core deviance being avoided is the violation of the deeply embedded Japanese societal norm of wa, harmony, and maintaining social face. The mechanism of abnormality. The cultural mandate in Japan is strict collectivism and deference. The greatest fear is causing shame or discomfort to the group. Therefore, the anxiety manifests as a hypervigilance, not over one's own comfort, but over the comfort of others. The dysfunction is severe social avoidance, but the underlying emotional core is one of profound responsibility and existential guilt over the potential to disrupt the group's harmony. The emotional reality. Take Kenji, a young office worker in Tokyo. Kenji develops an intense fear that his slight body odor or the redness of his cheeks is causing discomfort to his colleagues. This fear is so intense that it becomes a full-blown obsession. He isolates himself, refuses to make eye contact, and eventually quits his job because he is convinced his mere presence is offensive. His anxiety is cripplingly dysfunctional, but the content of the fear, being an aggressor of discomfort, is fundamentally different from the fear in Western social anxiety, being judged as inadequate. Western individualism encourages the focus on the self. Japanese collectivism forces the anxiety to manifest as a fear of violating the social contract of the group. A Western therapist would focus on challenging Kenji's beliefs about his own inadequacy. A culturally sensitive Japanese therapist would understand the anxiety is rooted in the fear of violating the cultural norm of wa.